My name is Shonte Drakeford. I am currently 36 years old. Mainly, anything that provides joy to my life is what I love to do. I snowboard, I fish, I camp, anything outdoors, I'm pretty much involved in. Currently, my favorite things I love to do is to play the video game and spend time with my chickens, ducks, and dogs, and my farm. And I like to exercise. I am a registered nurse and newly nurse practitioner. I've been working in healthcare total now about 13 years. I also teach childbirth education. When I was a registered nurse, I worked in labor delivery, the NICU, mother baby, and now I am a primary care provider for adults. My husband, oh man, I love that. I love that man. So my husband and I met, oh, we were young. I was 15 years old, he was 16 years old, and I had just moved to Maryland from Washington, D.C., and I hated everything about Maryland. And my husband was involved in the JROTC, which now he's in the U.S. Army. And I was in the marching band, and we met because we were walking home together, and we had a mutual friend, and we just kind of clicked from that day forward. We never broke up. We went through a lot of lifestyle changes. We went through going to separate colleges, and right after college, we got married in 2006. I was 21, he was 22, and we've lived all over. As I mentioned, he's in the Army, and we lived in Alaska, Georgia, Washington State. My husband is like my rock, my support, my best friend. He literally knows any and everything about me. We don't separate. If it's me, it's him. If it's him, it's me. He's an introvert, but I'm an extrovert, but we kind of mesh really well. And he just makes me laugh and is so supportive and caring. Even on the days that I don't feel well, my husband is a genius in my eyes. His whole goal in life is to make sure that I'm taken care of and I don't have any worries, especially after getting diagnosed with metastatic breast cancer. And we've dealt with IVF and just all the deployments of war, and we've managed to stay together. And I just love him so much. Like, oh, I can't imagine life without him. My diagnosis was and is a sort of long story. It started at the age of 25. My husband had just came back from Iraq, and the very next day I started exhibiting nipple discharge out of my right breast, and it was like a yellow color. And at that time I was a registered nurse, and my goal is to always try to catch anything early if I can, because I don't want it to impact me severely. So I went to see my doctor, and they gave me an ultrasound and told me I had dilated breast ducts. That's why I was having the nipple discharge, but it's normal, it's fine, you're young, don't worry about it. They didn't offer me a mammogram. I asked for one. They told me, no, don't worry about it, you're young. And unless the nipple discharge turns bloody, then return. Otherwise, just don't squeeze it and you're fine. At that time, I didn't have any lumps or anything, but they did say I had fibrocystic breasts. So I had a lot of microcysts involved. So maybe a few years later, I always was living with the nipple discharge, and the nipple discharge turned bloody one time, and that concerned me because that's when they told me to be concerned. And prior to that, I would at least try to get an ultrasound every 6 months, because that was all I was able to advocate for, was an ultrasound. So I went and got an ultrasound when my nipple discharge turned bloody, and they told me that they needed to do surgery to remove that breast duct. At this time, I did develop a cyst that was relatively large and quite uncomfortable, especially during my menstrual cycle. And I asked them, could they drain that so I could have less discomfort? I did a little bit more research at that time, and I asked if I could get like a biopsy because the cyst was always present and very uncomfortable. And since they're going in anyway, could they just do a biopsy? And they was like, yeah, sure, sure. It was almost like in a brush off way. So I had the surgery. They removed the breast, the nipple discharge stopped. But when I came out of surgery, the cyst was still there, still very big, and at that time was soft and squishy, but still gave me discomfort. And I was like, well, why didn't you guys remove the cyst? It was almost like, oh man, we forgot, but they didn't say that exactly like we forgot, but it just kind of talked around it. I was a little pissed, and I was like, well, why wouldn't they do that? And I really wanted to get like a biopsy of the cyst. Never was offered it, never was mentioned. So a few months after me having the surgery, probably like 6 to 8 months, I was exhibiting really severe pain, and they was telling me that's a part of the process of healing, and it was just probably scar tissue. I am triple positive, and me knowing that, that just probably increased the growth at the time, looking in hindsight. Also during this time, I was going through infertility. My husband and I was trying to have babies, and I was on oral medications, and started IUI, and directly a year prior to my diagnosis, I was doing IVF, and so I was injecting myself with a lot of hormones at that time. So fast forward to maybe 3 months after I had mentioned that I had discomfort in my breast and the lump was still bothersome. I still again wasn't offered a mammogram, even though I asked. It was just always, oh, we don't want to, introduce the radiation, especially since you're trying to have kids, and just was kind of like denying things and delaying things, and just, I guess, wouldn't take me seriously. And, in hindsight, I don't know if it was due to my age or was it due to my race. And I just, at the end of the day, was only offered ultrasounds, even to the point where they will only specifically ultrasound the problem area and not my whole breast or even both my breasts, which I found very odd. I came back to the doctor because the pain was just really severe. And one day the pain was so much so that nothing would help. And I almost had like this inflammatory response to my breasts. And I had like this superficial bump. And that really concerned me. And the cyst turned hard. And so I was like, what is happening? Something is happening. I went back to my breast surgeon, and since she was evaluating me prior, she felt that the cyst was much harder, and kind of perked her ears up at that time. So now she wants to send me to get an MRI. So I go get an MRI, and typically the MRI results come back in about 3 to 5 days or something. I got a call from my breast surgeon the very next day and told me to come back in today or tomorrow from that time to get a mammogram, an ultrasound, and a biopsy. So I'm like, oh, now you want to offer these things to me when it gets serious. But I was pissed because I've been asking for this for years, and now all of a sudden that the cyst is hard, and now you're more concerned. But they didn't tell me what it was. So me still thinking maybe it's just another benign condition, and I probably just have to get surgery again. And at this time frame, I've already failed IVF, and I was in the adoption phase. I'm a foster child, and that's always been in my husband and I's plan. And didn't know that would probably be our sole component of trying to have children. and we was about to put our adoption deposit down, and we was gonna adopt an older child, like preschool and older. So I said, let's hold off until we get the results. So during the biopsy, my husband and my best friend was really urgent to come with me that day. I was like, no, it's fine. It's probably just something else benign. And when they took my breast duct out, it was an intraductal papilloma then. So as I was getting the mammogram, the lady had this look. It's like they can't hide it, no matter how much they try. And I'm like, oh, that's not good. But it's probably still not thin. I got the ultrasound done and the biopsy. And as I was getting the biopsy, the breast surgeon came in and was asking all these questions about my breast cancer history. And if I had any history, I don't have any breast cancer history. My aunt was diagnosed stage 0 through a mammogram, her annual screening, a month prior to my diagnosis. And then I had a great aunt who had breast cancer. But other than that, no. And I'm like, stop there. I'm like, why are you asking me all these questions? Are you concerned that I have breast cancer? And she was like, well, based on the images, yes, but we won't verify it until we finish with the biopsy. So I started immediately getting frigid and shaking and becoming nervous. And I think that's when I had my first anxiety attack. And so I'm like thinking like, oh my goodness, how bad is it? And so I asked them, did it look bad? And the radiologist was like, yes, out of all the years I've done this, it's for sure cancer, and it looks bad, and it looks like it went to your lymph node. So we have to biopsy that as well. So I'm freaking out. I'm like, oh my God. So I get the results probably, it was a weekend, so I didn't get it till that Monday. And during that whole time of the weekend of me waiting for the biopsy, I'm like panicking. I'm on the internet trying to Google, and I'm on all these research documentations and just reading and just freaking out. And I was like, I had to calm myself down. I had to pray and just ask for God to take the worry away, because no matter what is the plan. I get the call, and they told me that it is in fact breast cancer, and I need to come in immediately to meet the team. And I was triple positive, so I had estrogen, progesterone positive, and HER2 positive. And they was telling me it's invasive ductal carcinoma, and it was like, well, it's the most common one, so, and you're triple positive, so that's a good thing. And I'm like, what's good about having breast cancer? But okay. So I'm like, what's the plan? So I go in, and I meet with my whole interdisciplinary team, the radiologists, the rehab, the social workers, the breast surgeons, and oncologists. And they started asking me, well, are you having any symptoms, anywhere else in your body, any pains or aches or anything? And as I start to think on it, I'm like, I kind of am. So that February, I was diagnosed in June. So that February, I had went snowboarding. Like I said, I like to snowboard. And, you fall, but I was having some pain right here on my right rib. And so much so I couldn't continue to snowboard. So I sat out for the rest of the day, and I went to the ER that evening because the pain just wouldn't stop. They labeled it as a contusion, and you can't see cancer on x-rays all the time. And so I was like, okay, they gave me like a medication shot to kind of help with the pain, and it went away. Then I was also having this constant cough. I would just cough. It would be every 5 seconds I would cough, but I thought I had allergies. And I'm bringing this stuff up to them. And then I was saying, a few months back, I was limping. And I worked on the unit as a nurse at the time, 12-hour shifts on my feet. And I was starting to limp, and I had some ache in there, but then I just thought it was sciatica. I did some yoga and went away. So I'm telling them these symptoms, and they're like, well, just to make sure, because you do have lymph node involvement, and they called it the bus, make sure the bus didn't leave the station, we want to give you scans. And so, okay. So I was technically diagnosed with stage 3 before the scans, and they was setting me up to get a port placed. I was going to do chemo first, a mastectomy, and then radiation. And I was just ready for it. I was telling my family I had stage 3. It's a plan. Don't worry. I'm gonna be good, and this probably take a year, but I'll be all right. I got a CT scan, and then I got a bone scan, and the nurse called me and told me, don't go get your port placed. And I'm suspicious. I'm like, why? And they're telling me, well, just don't go get it. And I'm like, you saw something on my scans, didn't you? But I know the staff can't tell me, but I know as a healthcare professional, it is something wrong. So I'm freaking out. I'm like, oh my God, it's spread. It's spread. It's spread. I'm going to die. It's spread. And so I go in and meet with a different oncologist, not the one I met originally. And he's like the chief of the unit and just kind of more experience. And so he sits me down and he tells me, well, we did find lesions in your lungs, your rib, some spots in your spine, and you have a huge tumor on your left hip. And I'm going to send you to an orthopedic oncologist to help manage that. But you have stage 4 metastatic breast cancer. And I'm like, what? What's that mean? Like, not really registering it, right? And me knowing what I knew at that time what stage 4 was, I was just like, death. And he was just like, but I want you to continue your life and still work and do the things that you need to do. I don't want you to stop. And I want you to just enjoy your life. And I'm like, okay, I am. But, I'm not realizing like this is a lifelong disease. And this is the disease that would kill me. But he didn't say it exactly in those words until I like really kind of went home and registered it. But my husband got it immediately. I started to panic, and I was like, well, I don't want to tell my family now after I've told them I have cancer. Now I gotta go back and tell them I have stage 4 and as my initial diagnosis. And I'm like, what? So it took me a while, but I was like, I can't hide this. I might as well just let it out. So I had to retell everyone that I was stage 4. And of course, you get the tears and the crying and are you going to die? And I'm like, no, I'm not. And I read like some articles, and this one glimpse of hope helped me out. It read, people who've had stage 4 metastatic breast cancer can live up to 10 to 15 years. And that I put in my brain, and I was like, I'm gonna live that long. At least I got a good 15 years. And some people would say, oh my goodness, you're gonna like, you only got 15 years to live or something. But me, I see it as, all right, if I'm gonna do this, I'm gonna do this well. I'm gonna live it to the fullest. So I started radiation immediately on my left hip, and I was put on crutches for about 5 months. That affected me a lot because I couldn't work, and nursing is all I know. And I can't work. I was doing labor and delivery, and one of the things he told me is that I need to continue working, but I work 12-hour shifts on my feet. There's no way I could work with crutches. So my supervisors was very welcoming and understanding and very supportive with my diagnosis. And my husband told me at that time I need to reinvent myself because I'm not going to be the same. I'm stubborn. I'm like, whatever. I don't need to do that. I'm going back to nursing right after I'm done with these crutches. But when I tried, it was ultimately I couldn't go back. It was just too tough. So after radiation, I got put on oral therapy. I didn't want any surgery because that's a part of my quality of life. So I didn't want to remove my ovaries and have any more surgical procedures. And I didn't get a mastectomy because my doctor told me it was not medically necessary. And but if I wanted to, I could, and I decided not to. So I've never had a mastectomy done. With this disease, it's like you have a bag of medicine and you could go through it quickly or could go through it slowly. And I'm just trying to marathon my way through this diagnosis. The most difficult part dealing with metastatic breast cancer for me is the pain. that was one of the things that I kind of asked God, that I don't exhibit as much as pain, but I guess it's kind of inevitable because I have widespread mets to my bones. Um, a lot of factors affect my bone pain, such as the rain. Um, that barometric pressure just intensifies the aching, and then the type of medicine I'm on increases my joint pain. And because I have a lot of spots in my spine, my back, especially in my lumbar area, I'm always rubbing in achy pain daily. Every single day, I am in pain. It's just a matter of tolerable pain. How severe is my pain today? Today, my pain right now is probably like a 3 out of 10, but I've had pains where it's like 100 out of 10. And what helps me with my pain is soaking in my bath. I love baths, it's relaxing. I like to put Epsom salt in there, and soaking in my tub gives me a lot of relief. It loosens the muscles and helps with the pain. I like to do massages, a chiropractic therapy, acupuncture. Having nausea out of nowhere and vomiting out of nowhere is very unpredictable and not a fun feeling. And my main thing is cognitive dysfunction. I don't like to forget. And I notice as long as I've been on my regimen now, my cognitive dysfunction is getting worse. So I will forget a word. It could be a simple word like I'm trying to say soda, but it won't come out. Or I could be talking and then I just lose my train of thought. And then my friends would tell me things that we used to do before cancer and the memories, and I will forget. And I will honestly forget. It's not in my brain. I'm like, I'm not exaggerating. And my husband and I in the beginning used to have kind of like quarrels about that, because he really thought I was like faking, that I couldn't remember certain things, especially with technology. And my doctor told me like long-term memories are good, but those short-term memories are what is affected a lot. And I don't want to forget, and I hate that. So pain is a major discomfort for me. The nausea and vomiting and the cognitive dysfunction. When I first started to understand that I am living with a terminal diagnosis, that I was stage 4 metastatic, I didn't believe it. And I was honestly a little angry at myself, and was asking, well, did I do enough? Did I fight enough? And could I've done more? Could I've fought harder for the mammogram? And then I had this realization. It was like, Shonte, it's not your fault. You did do as much as you could. You did try to advocate. It wasn't my fault. And the breast surgeon that I saw, she saw my records from the years prior, and she said, you did actually try to do the best that you could, and don't think it's you. And for a while, I thought it was my fault. And I had to get out of that mindset of thinking that it's my fault. And then I just kind of had to accept it. But I didn't accept my mortality yet. Because I know I'm going to die for this. Now, granted, I could die from anything else, but knowing that this is a big factor that I would die from this, I was like, well, how long would I live? My doctor never discussed prognosis with me, which I think is good, because statistics are what they are, statistics, and I could be an anomaly to that statistic. And I still do believe that I will be that anomaly. Accepting my mortality was something I had to do, after I had a niece pass. And I was like, I don't want to go to the funerals. I don't want to hear the word death. I don't want to hear anything terminal. Because I will project it onto myself and like think of my mortality, and I'll go dark sometimes and say, well, man, I'm gonna die from this. This sucks. And then, that having my niece die, it gave me like almost like a perspective of you have to accept this, right? And just live the best that you can with no regrets. And that's kind of how I navigate this disease now. And I have my days where um if I know someone progress, I get freaked out. And every time I get a scan, I get freaked out. I'm like, well, what if I found a new spot? So what is the next thing? Oh my goodness, like, would it keep growing? Can we stop it in time? But accepting this diagnosis is tough. But then at the same time, I see it as a silver lining because now I'm able to share my story, be an advocate, help others, and just I've always was living my life to the fullest. But now I just really have no cut cards. I have no time for crap. I'm very blunt in my delivery, but caring at the same time, and I just stress less. And that's weird to say when you have a terminal condition, like how do you stress less? But I really do, honestly do, before I got this diagnosis. And I know God has a plan, and it's for the good, and I'm seeing the good out of it. And so it took a while for me to adjust to the diagnosis, but I think now I have full acceptance of it. It took me a few months, and I started just to kind of reach out for resources and just look for support groups to kind of process this. And someone connected me with a person who was a nurse and had early stage breast cancer, but still was helpful because whenever I had the anxiety attacks, she understood what I was going through, and honestly was the only person who could really help calm me down. When I was first diagnosed, I am a big resource person, and I know there are organizations that's out here that's here to help you. So I started to look up local breast cancer organizations and see what was offered. But what mostly helped me stay connected with support groups. I am an Army spouse, and I went to support groups that the military offered, and it wasn't for specific breast cancer members, but it was for young people with any cancer. And so I found it that I was able to just go there and gripe and just talk what I really feel and, ask for suggestions. And I started reaching out to other organizations. They had car services, care packages, and I wanted to create a respite for my husband so he didn't always have to do everything. So I would reach out to my family for help, and I would take certain people with me to my appointments. And when I was on my crutches, I would ask them to, wheel me around. And then I would try to find things that was of joy for people that's often with people who have cancer. So I was able to tour the White House. So I thought that was pretty cool, and just kind of do things that I was probably holding off, and I was traveling more. So that was therapeutic. And then later, now Facebook was support groups was like amazing. And I was able just to kind of read and digest and understand and post and get a lot more feedback than anything. And then I established like close bond relationships with people who has metastatic breast cancer, and that relationship is so vital to my well-being because no one really truly understands this except for someone who's going through it exactly. And I really established like a super close bond with my support group out here in DC that for young metastatic patients, and really got close to one of my friends who's a part of this project, Shonte Randall. And the bond that you have with certain people is tight and close. And you accept the relationship that maybe one day one of us won't make it or be here, but you honor that time with them and you just enjoy it as much as you can. But mainly my resources It's all breast cancer type agencies. If they have care packages, I get it. If they have cleaning services, I get it. Um, Anything that will help me along this journey without having to do it by myself and provide some respite to my husband, I definitely take advantage of that. Shonte Randall is is we always called each other twins because her name is Shonte, my name is Shonte, and we was like, it's a Shonte thing. And we met through advocacy, and she came to me and was just like, and it was so quick that our friendship went so fast. And she came to me, she was like, hey girl, my name's Shonte too, and I just love your energy and how bright you are and how open and honest you are. And I'm like, okay, hey girl. And then we just, what really catapulted our relationship was that she just was starting to get into advocacy really well. And she was having an event and she was speaking at, and she wanted a familiar face in the audience, and she asked me to come, and it was out here in the DC area. And I was like, sure, absolutely. And from that day, we were inseparable. Like, we talked every single day through video chat, through text messaging, through FaceTiming each other. And I'm not even exaggerating, like every single day we would speak or have some form of communication. And when we had our bad days, we'll lift each other up. And sometimes our bad days were together. We would both be in pain. We were like, crap, but we'll muster through it, and we're gonna be all right. Get some heating pads, do this. We'll give each other suggestions. Take your pain medicine, girl. Stop trying to be, strong. And she'll tell me the same, and we'll laugh and joke together. We'll spend time with each other. Our bond got so deep that we took pictures with one another, and I'm honestly grateful that we did. And we just was there for one another, good days, bad days, happy days, sad days, and gave each other advice. And because she's so knowledgeable with certain things more than me, especially in research, she's like, I idolized her, the way she speak, the ways that she empowered everyone and impacted everyone, even now from her passing. And I was able to be fortunate enough to be with her during her last few days that she was there, and just try to give her some joy and some peace, and let her know that I would be okay. But when it just went so fast, and 1 week you're fine, you're fine, and then the next week you're not. And us doing this project together, it just even brought us closer, because we'll remind each other, hey, did you record your stuff? And and I don't know, it was just a bond that I can't even explain. And I love her so much. And we, you just establish bonds so quickly. And even we had a mutual friend who passed too. He was in our support group, and we just kind of helped each other cope through that. But she was just a beacon of light, and I'm sad that she's gone, and angry too, but I'm at peace at the same time, because I know that she wouldn't want me to silence my voice. And if anything, I absorbed all her powers. And being that other Shonte, we always have to say, that's the other Shonte. And now I feel like I'm the only Shonte left, but I still have her with me. And the voice is just going to be more amplified, because she fought literally to the end, like to bring awareness, to bring change. And that just empowers me even more. And I just love her for that, and lived a non-regretful life. And we just enjoyed life. And I know she did that to the very end. So she was a very special person to me and to everyone she touched, even if you didn't know her, and seeing all the good things that people are saying about her. It just knows that her legacy will live on. This is MBC project is so vital, because a lot of times, especially as an advocate, you you hear what we go through. But this project gets you to see what we go through and really kind of understand like our day-to-day struggle. And some people see the exterior of me and say, oh, she looks good, she looks fine, she doesn't even look like she has cancer, and this stigma of what cancer looks like, right? And just kind of showing my bad days and then showing my good days. I think this is something that needs to be shared all the time, because everyone's experience is so unique. At any time I could just vomit, but you know, people don't show that. I don't show that on my social media. I'm public with it, but not everyone is public with it. And not all the time my family understands what I'm going through. Even if I verbalize it, I would just tell them I'm having a good day. And if someone asks me how I'm doing, sometimes I lie and say I'm fine, because I don't want to almost put this burden on them. And I don't like to be pitied, but then I need them to know and understand the severity of this disease. And when I'm in pain and hunched over, and like especially in my back and spine, in my hip, and show that and I'm crying in the middle of the night because I'm having this huge spasm Charlie horse, and my husband has to rub it out, and the widespread aching and pain and the cognitive dysfunction that I go through in my mind, how it's changing my energy. Even it takes me an hour to do dishes, and this project is imperative because it's showing this my day-to-day life. And sometimes it's hard to ask for help because I don't know what help is sometimes. But you know, and also I like people who are doers, and I found sometimes if I've people who say they're there for you, and you could call on them, and I do, and they're not available or can't help me at the time, it just frustrates me. Not that they need to be at my every beacon call, but it's just that I'm really struggling, and if I'm calling for you, I really need help. But then like on my good days, you know, everyone gets to see my good days, you know, me exercising and running and playing with my chickens and dogs, and you know, running a farm and just being energetic. Like today I feel like right before this I was literally sleeping because I had treatment yesterday. I was sleeping up until the 20 minutes before I did this, and I'm just fatigued, and I had to kind of like pump myself up so I could get the energy. But I know after this I'm gonna go back into my bed. And this project just shows that the truth behind it. Instead of us having to say it all the time, you get to see it. And I honor this project for that. My good days, you know, I like to just go outside and just I have 2 acres of land, and I just look at my land, and I sip tea, and I just sit there and reflect on the things that are good in my life right now. And I reflect on that I'm having a good day, and I feel good, and I don't have a lack of energy today. I don't have any pain. You know, I'll be like, yes, no pain. You know, that's like a conquered thing. And I just sit and I reflect, and I just meditate, and I just relax. And that helps me and heal. And like I love to play with my dogs. They're my joy. You know, I have 2 German shepherds. I wasn't able to have children, and you know, I have 6 godkids, which I love, gives me so much joy. But they're not with me every day, but my dogs are, and I love playing with them. I love just the snuggles they give me, the unlimited kisses I get from them. And my husband makes me laugh like all the time. He is like the best person when I'm having a bad day. And sometimes it's a little hard on me. He just be like, girl, you fine, get up, you know. Oh goodness gracious, you having a bad day again. But just playing around. But then will help me when I'm cleaning and I'm in the bed, literally can't move. But he'll make sure he'll take care of the house for me and make sure I have water and tea and anything. So those things help me. And then I just play video games. I really love that. That's really relaxing for me. And traveling, oh man, that's like my joy. I love experiences, life experiences. And traveling is like one of those things. I don't care how many vaccinations I have to get. Like I went to Thailand and they gave me so many vaccinations. And I was like, I take them all just to get away and not think of cancer for one day. So those are things that just make me happy. And my chickens, oh man, like getting a farm and having chickens was so random. But you know, when you have the disease, you're like, why not? Like next week, I want to just learn how to weld. It's random, but like, why not? You know, I'm gonna get my boater's license. I don't have a boat, but why not? You know, so like I do things because why not? And I always believe in the philosophy of I do what I can until I can't, because one day I won't be able to do these things that I'm enjoying. And so I take stride in the things that I can do and honor that and just do what I can now for the now until I can't. And those days that I can't, that I have bad days, I accept those days and go through that bad day and just pray that the next day won't be bad. And sometimes they are consecutive, but I'm just grateful that I even have a day. And so I always look at the silver lining and everything. And I think that's what helps keep me motivated, even on my bad days. COVID, it was like a smack in my face. And very unexpectedly, of course, for everyone, but for me in particular, those of us who have stage 4 metastatic breast cancer, we kind of was already living that COVID lifestyle. And I know this is said a lot, but it's actually true. You know, I've gotten sick once since I've been diagnosed because of my low immune system. And I was literally legit shut down just from an upper respiratory infection for like 3 weeks. My doctor put me on quarantine. She was like, I can't have anyone visit me. I can't leave the house. And in retrospect, this is my life for real now. That was like a month time. And now this is my life. COVID had, like, I'm an extrovert. I feed off people's energy. I love to hang with my friends. And, you know, especially like, you know, my relationship that I had with Shonte, I like to do a lot of video chats, but it really has affected me. I had to kind of reorganize my lifestyle. And I was in a clinic at least once a week. And like I mentioned, like nursing is my joy. And I reinvented myself. I was teaching childbirth education twice a month. And then I was also in a clinic once a week, and I would see my patients. And that gave me a sense of pride and joy that I'm helping someone. When COVID hit, I had to transition because I'm so high risk. If I get this disease, I may die, you know, especially since I have lung nodules. I may, but I don't want to risk that. And so I have to be careful in any and everything. And even when they was having like the grocery stores open up for like the older community, I would go because I am a susceptible community, and they would look at me funny. And I was like, I have cancer. Although they don't believe me because the way I look, I'm like, I have cancer, I'm susceptible, and I don't want to get this. So I've been extra vigilant. I was always the one who traveled with the mask on when I traveled in the airplanes because I know the germ impact. Now it's a norm, but you know, people used to think I was crazy then, and you don't need a mask, and some people would assume that I was sick. I'm like, yeah, I'm sick, but not kind of like that. I'm trying to not get your germs. And so now this is everyone's norm. Everyone, I think, could kind of understand it, and everyone's life is changing. They're looking at life differently and understanding and valuing everything. And whereas I already been there, already done that. But working in telemedicine, it kind of disconnects me with my patient. And you know, I work in an underserved community, and a lot of them don't have video access, computer at that, even enough data to do a cell phone video chat, so I have to call. And so that reduces my capability to adequately assess my patients. And that is a barrier. And because I can't be there present in person, I'm losing like skill sets. I can't do pap smears anymore, biopsies anymore. And so I don't like that, because this is my joy. This is a part of my quality of life. But then I always have to like think on the end of this COVID disease. I don't want to get it. And it's affected our support groups. We used to meet together in person. And we know when you have a support group with those with metastatic breast cancer, you lose them. Like the last time I saw one of my friends, Ryan, was in our support group. And then a few months later, he was gone. And you never know who is going to be there. And you revalue time, and COVID is almost taking time. I always tell my husband, time is important for me. Time, and COVID is taking my time. It's reducing my interactions with my family and friends. It's reducing my travel capabilities. I had 3 trips set up. I can't do that now. And now I have to understand what my future is going to look like. And if I'm going to take those risks and say F it and go travel anyway, because of my quality of life. I don't want to be stuck in the house all the time. You know, my husband and I, we went away just to get away because we had to this cabin that was secluded, and it was just the most peaceful thing. And you miss the things that you used to be able to do. I can't get massages anymore, so my pain is heightened. I can't get an acupuncture anymore, so my pain is heightened. Now I have palliative care therapy because I don't know how to increase my quality of life. So I'm talking to my palliative care doctor and trying to understand, like my insomnia has increased. So now I'm on insomnia medications. Whereas I didn't have to do that before. I still have to go into the clinic to get my treatment done because someone once said COVID doesn't stop cancer. But the unfortunate part about it is that some people are getting delayed care because of COVID and of fear. You know, it's a lot of fear based of just even getting the disease. In the waiting room, I get freaked out because I'm around people that I'm afraid that I may get it. My anxiety has definitely increased. But like some good things is that I have more access to my provider now. I could directly message them and call them, and they're more available than they were before because they have to at this point. So it is some good, but it's definitely impacting my lifestyle. I have to do virtual workouts now. I don't know. And I think it's going to affect our eyes ultimately too, because we are always on the computer and it's going to be eye fatigue. So I got like some blue light blocking glasses to kind of help that. But I am also able to see my husband more. He doesn't have to travel anymore in the work. So I get to be with him every single day, which I love. So I don't know, it's good and bad of this, but some of the bad I wish I could just take away. COVID is hard, but then some it's a little good too, because now I'm able to advocate more, right? And more widespread, and then share my story even more, and hopefully increase the prospect of change. Being Black and having breast cancer, you are automatically a statistic. We're diagnosed at the most advanced stages, and our mortality is disproportionately higher, like 40% greater. And we have to understand, why is that happening? I was 26 having symptoms, nipple discharge, cyst, and I've met someone else who also was around the same age as me and got diagnosed with early stage. And she was, as soon as she was symptomatic, she didn't even have as much severe symptoms as I did. She was immediately put on a 6-month mammogram high-risk screening. Never heard of that. Never even heard of that in my diagnosis process. Perseverance is a word that, I think I lived with all my life. And perseverance is something that is unique to you, right? So I look at things in colors. Like there are multiple colors that's involved, and you may have different colors of your life. So one color of my life was um, being an army spouse and having to deal with my husband deploying to war and worrying if he's going to come back or not, or even be affected, right? Then there's another color in my life that I dealt with infertility, and not being able to have a child and adopting. And so then you got two colors added, and you just kind of move from one color to the next color, but you excel in that color, right? You kind of darken in that color. It was a little pale, now it's darkened because you got a plan. And then you got another color in my life where I was a foster child, and my upbringing and growing up in Washington D.C. and not having access and a lot of quality of care, and that's a color in my life. And then transitioning as a nurse practitioner from a nurse and traveling around and doing that's a different color. And then I think the most brightest color of them all now is cancer. And so if you combine all those colors, you kind of almost get a rainbow of perseverance. And everyone has different colors that they dealt with, and you just kind of move past that color and you darken it. You go through it, you darken it, and you move forward, and you just got to keep going. And some colors you stay there a little longer, and it takes a little while to darken that color, but in essence the rainbow at the end is really beautiful because you've persevered, and you could visibly see the perseverance in this rainbow.